this video is going to be just about the sphenoid bone. It's an amazing bone. So over here on this colored skull, it's this red-orange bone. All of this is the sphenoid. So you can see the lines here. Those are suture lines between bones. That's all the sphenoid. The sphenoid is a single bone, so there's only one sphenoid. So we're going to look at the features of it. This area here is called the sella turcica. Sella turcica. That means Turkish saddle. This concavity right here of the sella turcica is called the hypophyseal fossa. And the pituitary gland sits there. Why isn't it called the pituitary fossa? Well, the pituitary used to be called the hypophysis. Hypophyseal hypophysis. Okay, so that's the sella turcica, hypophyseal fossa. So now, if we look here, we can see two foramina, or canals. That's the optic canal, or the optic foramen. Remember, we're talking about the sphenoid bone. That's for the optic nerve, which is cranial nerve 2. That's our nerve of vision. That's a sensory nerve, right? Seeing is a sensation. Smelling, for the olfactory nerve, that's a sensory nerve, right? Okay, so optic canal or optic foramen. If we stick something through that, I'm going to stick a pipe cleaner through that, and now we look into the orbit. You can see, let's just pretend that's the optic nerve, then that's going to be attached to the back of the eyeball. And whatever the eyeball is sensing, it's going to travel on that nerve back to the brain. Okay, I'm going to take the pipe cleaner out so you can see the optic foramen. It's a hole. Okay. Now, let's see. So the optic foramen is here. Now drop down inferior to that, and we see this expanded, elongated opening. Superior orbital fissure. Superior orbital fissure. There are many cranial nerves that go through there, and those cranial nerves are going to end up, I'm going to stick a pipe cleaner, those cranial nerves end up in the orbit, and they're going to innervate, they are motor nerves, they're going to innervate muscles that move the eyeball. Okay? Okay, so now, just to review, optic canal, superior orbital fissure. Now we're going to see 3 foramina. Here, that's one that's very close to that fissure. This one that's farther posteriorly, and then a tiny one that's posterior to that. So this first one, the most anterior, that's the foramen rotundum. And that's for a branch of cranial nerve 5, the trigeminal nerve. This one is the foramen ovale, and that's for another branch of the trigeminal nerve, cranial nerve 5. Okay? And then the tiny one, foramen spinosum, and that's for the middle meningeal artery to pass through. Okay, so sella turcica, hypophyseal fossa, optic canal or optic foramen, superior orbital fissure, foramen rotundum, foramen ovale, foramen spinosum. Let's look at the list. Let's just see the list. I can see it. I think that's it. Have fun with the sphenoid.